Welcome to the Online Graduate Research Forum for Spring of 2016. My name is Lara Hall. I'm a graduate student in the Masters of Science in Interdisciplinary Studies program in the Department of Occupational Workforce and Leadership Studies. I have done research based on the benefits of workplace health programs. The background of the project is to analyze the benefits of workplace wellness and the effects that it can have on overall population health. I was fortunate enough to do this research through the Heart Hospital of Austin, located in Austin, Texas. My first learning objective was to collaborate with the CEO of the Heart Hospital, David Laird, and the supervisor of the Executive Wellness Department, Richard Wohl, to evaluate the success of the wellness program and determine where improvements may be made. The second learning objective was to analyze the financial benefits of wellness programs as a whole for larger companies. The third learning objective is to determine if the wellness program improves employee retention for the participating companies. And the last learning objective was to understand the overall improvement that having such a program can provide for employers. The practical use of this program is that it has been noted over the last 10 to 15 years, and especially with the creation of the Affordable Care Act, that the health of individuals with non-communicable diseases such as cardiovascular, obesity, and diabetes can be prevented, so that way they are not a larger burden later on once they become a serious health issue. Some of the highlights are, after my first day, I was able to meet with David Laird, the CEO of the Heart Hospital. And this was important to me because although I work in the same hospital, I do work at different times, and I was able to sit down and have a actual conversation with him, which was important to me. I was able to get insights into the overall population health that can be improved on by focusing on the prevention instead of treating conditions once they become an issue. I was also able to meet with the employees of the Executive's Wellness Program and talk to their nurse and administrative assistant to get their findings on the program. The first piece of literature that I researched was Anne Thorndike. Title of the article was Workplace Interventions to Reduce Obesity and Cardiometabolic Risk. Her article focused on the workplace being an ideal intervention spot since it's somewhere that you are every day, and that informing people on how to reduce their risk of obesity and cardiometabolic risk factors, that the company can actually save a lot of money, and even in doing this, it improves overall health. The second article that I had was by Howard Koh, called The New Federal Policy Initiatives to Boost Health Literacy that can help move nation beyond the cycle of costly crisis care. The point of this is that health literacy is not familiar to everybody, and that they may not understand the terms or what they can do to prevent them from having larger problems later on. So there was actually part of the Affordable Care Act, the Department of Health and Human Services National Action Plan to Improve Health Literacy, and the Plain Writing Act of 2010. And what this has done is brought to the attention of everyone that things need to be in common language, and maybe to pull out the medical jargon that they don't understand, so that if everybody does understand, maybe they can make a point of increasing their health knowledge. The last article is by Katherine Tryon. It was Making the Workplace a More Effective Site for Prevention of Non-Communicable Diseases in Adults. It states that a large proportion of the major non-communicable diseases, including cardiovascular disease, type 2 diabetes, some cancers, respiratory diseases, and some mental illnesses, can all be prevented with knowledge. So by addressing issues such as tobacco use or physical inactivity, alcohol consumption, or unhealthy diets, a lot of these issues can actually be treated before they become such large issues that you're trying to go backwards into something that's harder to fix. My learning activities did include talking with the staff at the Executive Wellness Center, and I did a lot of research online on the effect of overall wellness programs for the population. I did have strengths and weaknesses during this practicum. A strength was that I'm very determined and I love learning, and I was willing to do everything I could to get this practicum done and finished while informing myself so that I can further my career. Weakness was time limitation. In between school and work and other classes, it's very hard to remember to take time out for yourself or how to schedule things in such a way that you have time to do them. The best opportunity that I experienced was the ability to meet the CEO and staff of the executive wellness programs, simply because they're not employees that I normally interact with, and it's nice to know people that are higher up in the organization where you work. The threat would be motivation. As it gets towards the end of the semester, it's hard to keep that motivation and determination alive because you get so tired and it's just hard to do. I was able to do this by taking a small break one weekend to allow myself renewed motivation after the week. My future career plans are to see myself as an administrator of a small hospital or durable medical equipment company. I see myself helping with public health knowledge and prevention of non-communicable diseases. I do believe public health overall is a major impact that we are now seeing more and more of the research on. And of course, as a respiratory therapist, I enjoy helping others, so I would love to make a change and see that in my day-to-day activities. Thank you very much for your time. I appreciate you listening to my program, and I look forward to hearing your reviews.